We're back with another episode of a conversation about COVID with our panel, YPG Commander Colonel Ross Poppenberger, Command Sergeant Major Jamathon Nelson, Technical Director Larry Bracamonte, and Deputy Garrison Manager Ron James. Colonel Poppenberger, do you have some opening remarks?
All right, we're back here as we continue to do these COVID updates, talking through some of the things that are going on and fielding questions from the workforce. Again, I want to say to the entire workforce across all of our ranges, thank you for those questions. Thank you for caring enough to submit your questions and keeping the hard questions rolling in. We're going to, again, do our best across the panel here today to answer those questions and give you our perspective on some things. What I also want to do is just kind of highlight, as of today, there's 32 cases in Yuma. So the numbers have gone up slightly, but still really below the overall predictions. And so what I will say is we're in a good place compared to other locations in the nation that things are great. Up at Fort Greely, Alaska and Delta Junction, there's only been one case. And in the Fairbanks area, as of my last report for my folks up in Alaska, it's been 8 days with no new cases, which is another great thing. And I just want to highlight that the practices and policies that we're putting in place are working, because across all of our ranges, we still have no positive cases on any YPG personnel from CRTC through Yuma down to the tropics, and to include our tenant partners, the Military Free Fall School, the medical and vet clinics, and some of the others on post here, so and across our whole garrison as well. So I will say this, our policies and practices and procedures are working, and we're going to continue to stay the course. And with that, Mark, I'll turn it over to you, and we'll field some of these great questions that came in this week.
We're in a period of uncertainty about when life will return to some semblance of normal, and there's speculation that Governor Ducey might extend Arizona's stay-at-home order. In the event that were to happen, how much longer could YPG maintain its operations?
Yeah, so Mark, and I'm not going to speculate on what the governor is going to do. He's got all kinds of data points that he's looking at. And again, to me, it always goes with, hey, stay within your lane. And what I'll say is, through hopefully as we're getting through the worst of this right now, we have remained a viable, active test center. And so most of our missions across our ranges have been going on. And so the short answer to that, as I read that question, I thought, oh, that's an interesting question. How long can we sustain it for? We can sustain it indefinitely. We've pushed out folks that are teleworking, that can telework. And just earlier today, Larry and Sergeant Major and myself went out and saw, one of the ranges in operation that, folks were masked up with their proper protective equipment. They maintain their social distance, and our program partners were in Picatinny, New Jersey, looking back at the test results. And so we're collaborating through virtual means, and we're continuing to do our important mission. So the short answer to that is we can continue on for a very long time. Some of the things too that I think that kind of drove to that question, when we return to normal. Well, what I'll say is, and this is kind of me looking at YPG, I really look at there's going to be a new normal here. I don't think we will anytime soon ever get back to the way it was a month ago or 2 months ago, if that's what folks are looking at as normal. I think we have learned some valuable lessons on hygiene and some of the tactics, techniques, and procedures to safeguard ourselves. And goodness will come from this in terms of, I look at, fewer colds and normal flus. As far as, some of the other things, movie theaters and those sorts of things, well, hey, again, that's on the governor to establish. And we'll continue to follow suit.
Mr. Bracamonte, we've learned a lot about teleworking throughout this entire COVID crisis. Once we return to some semblance of normal or a new normal, are we still going to utilize telework to any extent?
Yes, I do see teleworking as an option for managers. Like you said, Mark, we have learned a lot. We've been able to effectively use it during this crisis. And I see it as a positive means of getting work done without necessarily being here at the proving ground. So yes, we will look for telework opportunities.
What about folks who have some underlying illness and they might be concerned to come back to post whenever that first come back to post order comes down?
For those situations, we're going to look at it on a case-by-case basis, and I encourage the employees to speak with their supervisors about the medical conditions so that the right choice can be made with respect to telework. And obviously, we do care about the health of our employees, so first and foremost, so we will look at that on a case-by-case basis.
Hey, Mark, let me jump on, tackle a portion of that as well, and kind of address a specific question that came out. I think somebody last week had asked a question. I think we kind of missed the mark on our answer. They had talked about equity in teleworking, and my comment was, hey, you can't bring an M1 tank home to work. Well, apparently, and this came in as an anonymous question, but apparently this individual has some challenges with the supervisor in terms of, I believe this individual has one of those jobs that's conducive to teleworking, but not being allowed to telework, as if I understand the question. What I'd say to this is hey, we're pushing out to distribute and get spread out across the board and social distance. But if there's some concerns, there, I look at trust as a major factor. And so, perhaps there's not trust from the supervisor to the employee that really needs to be, dealt with at the supervisor-employee level. And so, whoever you are that asked that question, one, we all have open door policies. If there is a disparate inequity across the YPG ranges, I want to hear about it. I want to know what's going on, because from this particular question, I can't wrap my hands around it. But generally what I'll say is perhaps there's a lack of trust on the supervisor to you as the individual, perhaps not. So we need to kind of pull on this and understand what's going on. But I know the managers that I deal with and that we talk through, we talk through these things, and we ensure that there is equity. So again, I don't know the level of it, and I would really like to understand a little bit more. Come see me on my open door policy, but talk with your supervisor. And I probably don't have time to talk with every teleworker out there, but talk with your supervisor if there's something, and let's have this issue trickle up to the top. But if I didn't hit the mark there on this one this time, come talk to me. I want to hear what's going on.
Mr. James, we talked in previous videos about how much the YPG family cherishes its first responders. And evidently there's some concern about do our first responders have the PPE that they need, and if not, are we doing something to ensure that they get it?
I appreciate that question. I think in our first video I said that's the group of people I worry about the most because they're the most exposed. So the simple answer is yes, they have enough PPE. And secondly, you'll see things that we have in place to preserve that PPE. So we actually just got a new shipment today of N95 masks for our first responders. We didn't really need it. But it's enough to carry us over. It's not excessive. But what we're doing to preserve things like N95 masks is we're having our gate guards wear the cloth masks that the riggers have made for us and some volunteers have made for us, and putting them behind barriers. We're doing the same thing at the VCC. We're doing the same thing at the ID cards. So we got those people who are up front protected, so that then we don't have to dip into our PPE reserves, and we're keeping those reserves for when we actually need them.
I have one follow-up question. It's not entirely related to COVID-19, but it's something that came through from a member of the YPG family. They were talking about religious gatherings, and specifically there's a Protestant service, a Catholic service, but not so much for other faiths. Is that something that you could address as Deputy Garrison Manager?
Yeah, I can address that. So I'll go back to just gatherings in general first, and then I'll get specific on the religious part of it. So last week we had a question about summer camp, what that's going to look like. And what I said was we are going to have summer camp. It's going to be different. It's going to be the new normal, which we don't know exactly what that is yet. It'll have some amount of social distancing, more safe practices. So in general, you know, if you look at Org Day or Fall Fest, those kind of things that we normally do here at YPG, we will do them. We'll just have to figure out a safe way to do them. So going back to the religious gatherings, if we're missing the mark on a religious gathering, the Garrison chaplain is here to service all faith groups. So any faith group that we have here that you feel is underrepresented, please contact the Garrison chaplain. He's there to serve us, and so he's there for all faith groups.
We've been utilizing increased hygiene measures since this crisis began. But folks talk about how some places in the country, for example, have turned off all water fountains as a sanitation measure. But we haven't done that here. Why hasn't YPG done that?
You know, that's one of the reasons we do these briefs, is never really, you know, came to mind that as something to look at. There's a lot of things going on, and we rely on employees with these questions. You know, never really thought about the water fountains. So as we got this question, we started looking into it. We've done several things to stop the use of the water fountains. One is the social distancing and the teleworking. You know, in this building right here, there are very few people in this building. And then we need to really look at if we're going to shut off the water fountains. Because when you start talking about it, how's a water fountain different than, you know, washing your hands in the restroom? Really, all your hands are contacting it. So if you continue to use, you know, good personal hygiene and using hand cleaner after you use those, if you're filling up a water bottle because it's going to be 100 degrees this week, you know, we are not the rest of the country. Our temperatures are starting to rise, so do we need to shut them off? It's something we'll look into, and those are the kind of questions that we need, because we're not going to see everything and catch everything. So it's something that we will look into, and then how long do we leave them off? So we'll look into it, see how many people are using them, and try to get an idea of do we need to shut them off? Because there's, like I said, there's probably, you know, less than 10 people in the building today, you know, whereas there's probably 100 on any other given day.
We had another question about the cleaning solutions that have been distributed to folks around YPG. There was some concern, was it adequate? Did they get what they were supposed to be getting? What should these folks have gotten as a cleaning solution?
So the question specifically dealt with Pine Sol solution, and it even gave, you know, the diluted, what it was being diluted to. What they should be, because Pine Sol's not on the CDC list. I looked it up. And what they should be getting and what is being distributed is Smart Clean. That is what, you know, just about all YPG personnel and Garrison people are being given. It's in the spray bottle. It's called Smart Clean. It's mixed 3 ounces to 5 gallons. That is on the CDC's list, and that's what you should be getting. If you're not getting that, you need to talk to your supervisor or manager. Because, like I said, I did not see Pine Sol in any form on the CDC's approved cleaning list.
One final question, Sergeant Major. We talked in an earlier video about ICE comments, that was an avenue that folks could ask a question anonymously to senior leaders. Do you have any concerns about the way ICE comments are being used right now?
So I actually like getting ICE comments. I mean, that's how we get feedback. And a lot of times the comments that we get, they're hard to get results on because we're not getting the full story. When you're doing an anonymous ICE comment, I understand why you're doing it anonymously. However, you're leaving us kind of tied where we can't look into it or go back and ask and make sure that the situation was resolved. One of the last ICE comments we got was, you have to understand how the system works. When you put in a dissatisfied comment into ICE, it goes under that, whoever you put it in for, it goes under them and it gives them a derogatory mark. So for instance, the last one, it was put under ACS. Well, it didn't have anything to do with ACS, but it was a dissatisfied comment card. It had to do with DECA, the commissary. Well, because it was sent under ACS and the question had to do with DECA, ACS still gets the negative downgrading on the dissatisfied comment. So put a lot of thought in and to where make sure it's going to the right place. If you're going to do it anonymously, make sure you give us all the facts so we can follow up without your input. Otherwise, we're just reading 2 sentences trying to figure out what's really going on. And if you do put your information down, we probably will contact you, but we want to contact you to correct things. That's the only thing we have really to get a sense from the residents, from the workforce on how things are going. We want to fix them. So we want to be able to reach out to people and ensure that it was fixed. People that have put in ICE comments, I've gone and visited them and made sure that, hey, this is what you said. Has that been addressed? Are you satisfied with it? All right, because we will get personally involved to ensure that it does, and just put a lot of thought into it. Because we are seeing a little bit of an uptick in ICE comments because a lot of people are sitting at home, and that's one way of expressing frustration, and that's fine. We just need to know, we need the ability to deal with it, so we need all the information. And sometimes that doesn't always work anonymously.
Colonel Poppenberger, the Secretary of Defense has extended the stop movement order for folks in uniform to the end of June. How is that going to affect YPG operations? I mean, specifically, Cold Regions Test Center and YPG had changes of command scheduled before the 30th of June. What's that going to look like?
Yeah, right. That's a good question, and it's more than an indicator. It's actually a policy memo that he recently put out over the weekend, or Monday, I think it came out. And so yeah, the stop movement order is in effect until 30 June right now. And so how we're going to deal with that, we don't know just yet. I will say this, White Sands Missile Range just did their change of responsibility for their Command Sergeant Major. Command Sergeant Major Prosser, who was Sergeant Major Nelson's predecessor, is now at White Sands, and they did it virtually. There's just a lot of unknowns on how we're going to do it. You know, we're planning the Yuma Proving Ground change of command for the 25th of June. We might shift it back a week. Not sure right now, or we might do a virtual one. And so there's a lot of unknowns. Same with Cold Regions. Cold Regions was supposed to happen in late May, and they're under a stop movement order. And so I've asked ATEC headquarters for some guidance on it. And so we're all sorting through, you know, how we're going to do this and honor the stop movement order and maintain the schedule, because you know those positions, my position and Colonel Todd's up at Cold Regions, are centrally select list positions. So there's a whole pipeline of guys, you know, coming behind us, and so if it is delayed, it won't be delayed by much. Now, that being said, the Army is doing some phenomenal things, just like you know, we're continuing our mission here. In those personnel sections, they're continuing their mission. So Soldier for Life Transition Assistance Program is still going. So for those soldiers that are retiring and those things that are out there, that they're doing virtual retirement counseling. And so the process continues on without going and sitting in those classes by themselves. So we'll continue on. We'll make some decisions as time comes. But we're still digesting this recent policy memo that came out. And a lot of it's going to be based on, you know, what the virus is doing between now and then as well, and on how we go forward. There is something that kind of tied into that, and some of a question along my new normal, or my first question as I talk about new normal, and you know, some questions kind of nibbling away at, hey, you know, what do we do? You know, that policy from Secretary Esper came out saying, you know, military won't travel outside the local area, and I just figured I needed to get online and define that. It's out there in our policies, but you know, the bottom line, our local area is 250 miles, and we have not changed that. So that's what military can travel. Now, when you look at it, you know, there's some hot spots that are within that. Phoenix, Las Vegas, Los Angeles, and San Diego are within that 250-mile radius. So for the military members, we can control that, and we cannot let them go to those locations. When they submit their leave request, their supervisor can deny it if they're planning on going to those areas. It's highly encouraged for DA civilians to not go to those areas as well. But as far as leave, we're still at our same policy of 250 miles. And I just kind of wanted to highlight that. Now, all of that said, again, we are still at the governor's stay-at-home directive that have come out, and so we all have a civic obligation to stay home. So you can take leave, and there's a lot of things to do while you're taking leave. You can clean up your house. You can do a lot of those chores and those things that you have been wanting to get to and just haven't gotten to yet. So again, just kind of wanted to highlight some of those things and hopefully answer some of the other questions that had come up. With regard to one of our main contractors, again, there's a couple questions that address that, and what I'll say is the contractors set their own policy. And so if you're a contractor personnel, the best thing to do is filter some of those questions up through your contractor chain of command and get some answers to those questions. At the end of the day, we follow, we provide the contractor the requirements we need met, and they supply us manpower to do those tasks. And so outside of that, making policy decisions for contractor personnel, we don't do that. But we do for, definitely do for military and for DA civilians under, Secretary Esper's policy memo that came out. I think that kind of sums everything up, and I'll just kind of close out here. I've answered a lot of questions. Again, I really appreciate those hard questions coming in. It makes us think through what we're doing and how we're dealing with this crisis going on. I will say that YPG continues to be a strong organization. It's a fantastic organization. It's all the hard work that you all are doing and adhering to the policies that we put out. I've said multiple times before, it's a fluid and dynamic environment. Things are changing rapidly. Policy memos are coming out from higher headquarters constantly, and so we're trying to figure out and make the most sense of these things that come at us, so we can continue the mission and still serve the folks that do such good work for us day in and day out. So again, keep those questions coming, and we're going to keep these videos going as we continue on through this. Thanks.